Welcome to the deep dive. If you're prepping for nursing exams and need a fast, focused look at measles pathophysiology, well, you're in the right place. Our mission today, a quick, solid breakdown will hit 6 key areas: risk factors, pathophysiology, the signs and symptoms, diagnostics, treatment, and critically, nursing interventions.
Sounds good. Let's dive in.
Okay, let's unpack this straight away. Starting with risk factors, we need to know who's most at risk and especially what's modifiable, right? Things we can actually influence.
Right. The big one, the absolute key modifiable factor, is incomplete MMR immunization. Simply put, no antibodies high risk.
Makes sense.
But there's another one, often kind of missed in quick reviews, vitamin A deficiency.
Oh, interesting. How does that play in?
Well, it really weakens the respiratory mucosal lining. That first barrier the virus hits. Vitamin A keeps it strong. Deficiency compromises it.
That's a great link for memory. Vitamin A deficiency equals weakened initial defense. Okay, and the non-modifiable stuff. We're talking age mostly.
Exactly. Age is a big one. Young children, their immune systems just aren't fully developed yet. They're particularly vulnerable.
Got it. Okay, let's move to the core. Pathophysiology. What actually is this virus, and how does it cause trouble?
So we're dealing with the Morbillivirus, and its transmission is purely airborne, super contagious through droplets.
Airborne, right. So once someone breathes it in,
Right.
what's the path? You mentioned viraemia. That's virus in the blood, yeah.
That's exactly right.
Okay.
First, it hits the respiratory epithelium, the lining of your airways. Then, boom, it moves fast into the local lymph tissue.
Okay.
From there, you get the primary viraemia. The virus basically hitches a ride in the bloodstream to go systemic. Everywhere.
Everywhere. Wow. And the rash. Koplik spots.
Here's the really crucial bit for your exams. The classic measles rash and those unique Koplik spots in the mouth. They aren't directly caused by masses of virus, no. They're actually the result of the body's own immune response fighting back specifically, the T-cell mediated response.
So the body's reaction causes the main signs we see. Huh. And I read something about immunosuppression.
Yes, this is huge. The Morbillivirus actively targets and destroys memory lymphocytes. Think of it like an immune system eraser.
An eraser? That sounds bad. It leads to long-term issues then.
Precisely. It causes profound immunosuppression, sometimes for months or longer, making patients incredibly vulnerable to secondary infections. That's where the real danger often lies.
Okay, that connects a lot of dots. So if that's a pathology driven by the T cells and this systemic spread, how does this look clinically? What are the signs and symptoms a nurse needs to spot?
Right, you need to recognize that initial phase, the prodrome. Think 3 C's, cough, coryza, which is just a fancy term for a runny nose and conjunctivitis, pink eye, plus a high spiking fever.
The 3 C's and fever, got it. What about those spots you mentioned, Koplik spots?
Yes, they are the hallmark sign you need to look for. Small, bluish-white specks on the inside of the cheek, the oral mucosa, usually pop up a day or two before the main rash.
Before the rash. And you said they're pathognomonic, meaning if you see them, it's basically measles.
Exactly. Pathognomonic means uniquely characteristic of a particular disease. See Koplik spots. Think measles. Then comes the rash.
Describe that rash for us.
It's maculopapular, meaning flat spots and raised bumps. It typically starts behind the ears, along the hairline, and then spreads downwards, covering the body.
Downwards from the head. Okay. Any other symptoms to watch for?
Definitely. Photophobia, sensitivity to light is common. Lethargy, just feeling wiped out. And because of the fever and illness, you'll often see compensatory signs like tachycardia, a fast heart rate, and tachypnoea, fast breathing.
Makes sense. The body's trying to cope. All right, let's shift gears slightly to diagnostic findings. Patient presents with the 3 C's, maybe Koplik spots. How do we confirm it's measles?
The absolute gold standard is RT-PCR. That's a test on a respiratory swab, usually, that directly detects the virus's RNA, confirms the virus is there.
RT-PCR. Okay, what about blood tests? Serology.
Yep, serology helps too. Finding positive IgM antibodies indicates a recent acute infection. Seeing IgG antibody levels rise over time also confirms it.
IgM for acute. IgG showing the response building up. And basic labs, like a CBC. Anything typical there?
Good point. On a complete blood count, you often see leukopenia, low white blood cell count, and specifically lymphopenia, low lymphocyte count.
And that low white count helps point towards viral rather than bacterial, right? Since bacteria usually cause high counts.
Generally, yes. It's a useful clue in the overall picture.
Okay, let's quickly summarize treatment before we hit the nursing care.
Treatment is, well, overwhelmingly supportive. There's no specific antiviral cure for measles itself.
So fluids, rest.
Exactly. Encourage rest, Push fluids to prevent dehydration, manage that high fever with antipyretics, things like paracetamol or ibuprofen.
And vitamin A. You mentioned that earlier as a risk factor.
Yes. Crucially important in treatment too, especially in areas where deficiency is common. The WHO recommends vitamin A supplementation because it's proven to reduce the severity and the risk of complications, like pneumonia and death. It links right back to supporting that mucosal integrity.
Good connection. What about antibiotics?
Only if, and only if, there's a secondary bacterial infection, things like bacterial pneumonia or an ear infection, otitis media. Antibiotics do nothing for the measles virus itself.
Right. Supportive care, vitamin A, and antibiotics only for secondary infections, no specific antivirals.
Got it. So this brings us to the crucial part for our audience, nursing interventions and considerations. What does all this mean on the floor?
Okay, immediate priorities. First, monitor vitals closely. You're watching for any sign of respiratory distress that pneumonia risk is real, either viral or secondary bacterial.
Respiratory assessment is key. What else?
Maintain hydration and nutrition. Fever and feeling unwell can lead to dehydration quickly. Offer fluids, maybe small, frequent meals if tolerated, and manage that fever for comfort with the ordered antipyretics. Makes sense. Comfort, hydration, monitoring. What about preventing spread? You said it's airborne.
This is non-negotiable. Airborne isolation. Immediately. That means a private, negative pressure room if available, and anyone entering must wear an N95 respirator. Measles is incredibly contagious.
N95s for everyone. Strict isolation. Okay. And thinking back to that immune system eraser effect, what complications are we actively assessing for?
You need to be vigilant. Assess regularly for signs of pneumonia, changes in breathing, cough, oxygen saturation. Check for otitis media ear pain. And watch carefully for any neurological changes, which could signal the very serious, though thankfully rarer, complication of encephalitis.
Pneumonia, ear infections, encephalitis. Got it. Anything else for the nursing role?
Absolutely. Education is huge. You need to educate caregivers, families about how measles spreads, the importance of isolation, and critically, the vital role of MMR vaccination in preventing this in the first place. Vaccine compliance is key public health.
Excellent summary. So we've really covered the whole journey from those modifiable risks like vitamin A and vaccination through the immune-driven pathology, the telltale signs, and right up to needing that N95 and vigilant monitoring. It really synthesizes the pathology with the practical interventions.
It really does. And that connection, particularly the immunosuppression part, leads to an important thought, doesn't it?
Go on.
Well, something for you listening to really mull over. Knowing that measles effectively damages the immune system's memory, destroying those memory lymphocytes, how might that understanding change your long-term patient education? Think about their susceptibility to other illnesses, maybe even months or years later. How do you discuss that future risk?
That's a powerful point to consider, the long shadow of measles. Okay, that wraps up our deep dive for today. Thank you for joining us.
Good luck with your exams.
Yes, good luck with all your preparation.